Hey everyone, and welcome back to The Explainer. In our last lesson, we tackled the classic eating disorders. Anorexia nervosa, bulimia nervosa, and binge eating disorder. Today, we're going to bridge what we just learned about those classic categories to a whole new set of life-threatening conditions. We're talking about the ones that hide in the gray areas, often perfectly disguised as just everyday habits, or even as extreme dedication to health and fitness. So, think about this for a second. What happens when severe eating disorder symptoms just don't fit neatly into the rigid diagnostic boxes we just studied? Consider patients whose dangerous behaviors might not tick every single box for anorexia or bulimia, but they're still facing incredibly severe health consequences. Does the lack of a classic label mean they're in any less danger? Absolutely not. Here's our roadmap for today. We'll quickly move through beyond classic eating disorders, look at biological and medical manipulation, discuss the illusion of health, touch on unspecified in-campus behaviors, and then finish by bridging to the athlete. This is going to set us up perfectly for our next lesson. All right, let's jump right into part 1, beyond classic eating disorders, specifically understanding OSFED. Okay, so let's look at this definition. OSFD stands for Other Specified Feeding or Eating Disorders. This is a bucket for disordered behaviors that just don't meet the full clinical criteria for anorexia, bulimia, or binge eating disorder. But, and this is the absolute crucial takeaway here, they still significantly impact health. It is so vital to understand that lacking a classic clinical label does not somehow reduce the severity, the psychological toll, or the very real physical dangers of these conditions. Moving right along to Section 2, biological and medical manipulation, hiding behind routine and illness. First up in this category is night eating syndrome, or NES. This is basically a cycle of eating that's heavily shifted toward the late evening and nighttime hours. Repeated bouts of eating happen after waking up from sleep, or someone might just consume a massive amount of food right after their normal evening meal. Psychologically, it's usually driven by this really deep-seated belief that they literally cannot fall asleep without eating a huge meal first. And note that unlike bulimia, these episodic late-night food binges are not followed by any purging behaviors. Take a look at this staggering number, 50%. Strikingly, individuals with NES might actually consume 50% of their total daily calories after their evening meal. Just imagine the metabolic confusion going on there. This massive late-night caloric intake significantly increases the risks for severe sleep disturbances, unwanted weight gain, and long-term issues like type 2 diabetes and metabolic syndrome. Next is a highly specific and honestly terrifyingly dangerous condition called Diabulimia. This disorder affects folks with type 1 diabetes who intentionally mismanage their insulin, specifically to manipulate their weight. It's a dangerous manipulation of a life-saving medical treatment. Emotionally, it's driven by intense anxiety over body image and a pervasive, overwhelming fear that, as they put it, insulin makes me fat. So what are the red flags we actually need to watch out for? Keep an eye out for skipping insulin injections, using less than what's prescribed, actively avoiding diabetes-related medical appointments, and neglecting to fill prescriptions. The stakes here are literally life and death. The long-term complications of diabulimia include blindness, kidney failure, blood vessel disease, and acute episodes of diabetic ketoacidosis, which is life-threatening. Now, let's explore Section 3, the illusion of health, when healthy becomes pathological. Here, we explore disorders that hide behind a socially praised passion for fitness and quote-unquote clean eating. Let's look at orthorexia nervosa. This is an extreme, highly unhealthy obsession with eating only healthy or pure foods. The cruel irony here is that this extreme focus on food purity actually leads to a diet that is nutritionally unbalanced and completely lacks moderation. And since we're studying human nutrition here, you should know this extreme focus is especially common in high-pressure fields, including right here among medical, nursing, and dietetic students. How does this obsession actually manifest day to day? Well, through obsessive food classifications. Foods are rigidly put into tiny boxes. They're good, clean, bad, or forbidden. This rigid categorization totally strips away the concept of moderation. It turns basic, necessary human nutrition into a pathological obsession, causing massive psychological stress whenever a so-called forbidden food is even in the room. Switching gears a bit, let's talk about muscle dysmorphia. While a lot of the eating disorders we've discussed skew heavily female, this one primarily affects males. It's an unhealthy preoccupation with the idea that your body is simply too small or insufficiently muscular. Here,
The endless pursuit of gains and spending hours at the gym acts as a socially acceptable mask for a deeply distorted body image.
You might look at these guys and think, wow, they are so dedicated. But notice how this supposed dedication actually results in severe life disruption. We're talking lifting weights for hours every single day, continuing to train even with serious injuries, and prioritizing exercise over work, school, and relationships. It inevitably leads to social isolation, physical harm from overtraining, extreme dietary rigidity, and often the dangerous abuse of diet pills or anabolic agents. Let's transition to Section 4, Unspecified and Campus Behaviors, the College Environment. Let's bring this directly into your world and look at disordered behaviors that are frequently normalized right on college campuses. First, a really key distinction. Atypical anorexia nervosa meets all the clinical criteria for anorexia, except that the person's weight remains within or above the normal range. So the psychological severity, the dietary restriction, the immense terrifying fear of weight gain, it's all identical to classic anorexia, even if their physical weight hasn't dropped to a dangerously low threshold. This makes it incredibly hard to spot with just the naked eye.
Then we have purging disorder. This is defined by recurrent purging to alter body shape or weight without prior binge eating. Remember when we covered bulimia, we saw that distinct binge and then purge cycle? Well, purging disorder shows us that compensatory, dangerous behaviors like vomiting to control weight can exist entirely on their own, totally independent of any binging episodes. And here's a term you've probably heard floating around at some point: Drunkorexia. Now, this isn't an official medical term, but it perfectly captures a highly normalized yet incredibly harmful campus behavior. It describes college students who use extreme fasting or excessive exercise specifically to compensate for the massive amounts of calories they plan to consume during heavy alcohol consumption. It mixes severe caloric restriction with binge drinking, which is just a terribly toxic combination for the human body.
Let's also look at how these restrictions can be disguised as dietary identities. We call this veganism as a mask. Now, obviously, a vegan diet is incredibly common and usually followed for entirely valid environmental, cultural, or ethical reasons. However, some young adults use this strict dietary identity as a really convenient disguise to hide an underlying eating disorder. It gives them a socially acceptable excuse to refuse a wide variety of foods and severely restrict their caloric intake without raising immediate suspicion from their friends or family. Finally, let's wrap things up with Section 5, Bridging to the Athlete, the Next Frontier. As we conclude our look at these hidden disorders, we really need to look ahead to how these behaviors impact physical performance. What we've seen today is a clear path to pathology. Step 1, adopting a socially praised healthy habit. Step 2, progression into strict obsessive rigidity. Step 3, severe disruption of normal physiological function. It's a clear pattern where seemingly healthy habits in high-pressure environments can quickly snowball into devastating physiological disruption. And think about it. Who operates in the ultimate high-pressure environment when it comes to body shape and physical output? Our sources remind us that conditions like orthorexia and muscle dysmorphia are exceptionally common in high-pressure fields, dancers, and competitive athletes. The sheer, relentless drive to perform at peak levels creates a massive vulnerability to these exact gray area disorders. So, I want to leave you with this final thought. If these life-threatening behaviors can so easily hide right in plain sight behind the mask of health and fitness, how much damage are they doing to the hidden physiology of our competitive athletes? Keep this crucial question in your mind, because it is exactly what we're going to unpack in our next explainer when we dive into the female athlete triad and REDS. Thanks for joining me for this lesson, and I'll see you in the next one.